The broadcast is now starting. All attendees are in listen-only mode.
Thank you for joining me as we walk through Executive Order D 2020-38. What does it mean? How does it work? And next steps. Executive Order D 2020-038 was signed on April 15th and is effective for 30 days after the order. The purpose of the order was to prioritize essential healthcare services during the COVID-19 pandemic, providing flexibility to expand the workforce and to ease regulations for inpatient pharmacies. The order also suspended restrictions around nurse and nurse aide educational programs. One way to expand the workforce is through expansion of scope of practice for those healthcare workers working in inpatient facilities. Hospitals and other inpatient settings are experiencing staffing shortages due to the unprecedented number of admissions. Temporarily relaxing regulations to allow for the expansion of scope of practice and delegation will allow these facilities the flexibility to cross-train facility personnel to perform delegated healthcare services regardless of their traditional scope of practice. This is accomplished in two parts. First, by expanded delegation, and second, by expanded practice. The first question is who can delegate? The executive order addresses the expansion of delegation for these 6 professions: physicians, physician assistants, advanced practice nurses, certified nurse anesthetists, registered nurse, and respiratory therapists. The next question is what can be delegated? Any of these professions can delegate any service that is within their scope of practice. So, for example, a registered nurse can delegate nursing tasks to a non-registered nurse. Respiratory therapists can delegate respiratory therapy services to be performed by a professional that's not a respiratory therapist. What are the parameters of this delegation? So the person delegating the service must ensure that the delegatee has the knowledge, skill, and training to perform the service prior to delegation. This is where cross-training comes in. The next question is to whom can these services be delegated? The executive order contains a list of those healthcare professionals where their scope has been expanded to allow them to practice under delegation while working in a hospital or other inpatient facility. The list includes surgical assistants and technologists, certified nurse aides, physical therapists, occupational therapists, speech-language pathologists, podiatrists, optometrists, chiropractors, dentists, dental hygienists, and veterinarians. The executive order also contains a special authority allowing certified registered nurse anesthetists and anesthesiologist assistants to work outside of the operative setting. So, for instance, in emergency departments or critical care settings to perform airway management. Temporarily opening up traditional lanes allows the hospital to identify gaps and plug qualified healthcare staff into non-traditional roles to meet the immediate needs of the facility in caring for its patients. So, for an example, a hospital-employed physical or occupational therapist may cross-train to perform delegated respiratory services, or a surgical assistant may be able to work outside of the operating room and in assisting to set up ventilators through the delegation of a respiratory therapist. Or in rural settings, a veterinarian may be utilized to manage ventilators. With effective gap analysis and cross-training, the possibilities are endless. The executive order also addresses satellite pharmacies. The order helps ensure that hospital pharmacies are able to meet expanding patient needs during the crisis by reducing restrictions on the hospital satellite locations. So the executive order suspends rules that relate to how far the satellite pharmacy can be from the hospital. It suspends the requirement for a pre-registration inspection for satellite pharmacies. It suspends regulations around technical and space requirements and security, and it suspends regulations that dictate the minimum hours of operation of a satellite pharmacy. This will open up opportunities for hospital pharmacies to open satellite pharmacies should that be necessary to meet the needs of expanding bed counts. The executive order also specifically addresses nursing and nurse aid educational programs. Prior to the executive order, nursing schools were challenged with students who had no placement for in-person clinical education. How would their students successfully complete the semester, or worse yet, graduate this spring? Nurse aid programs were faced with the same challenge. In addition, nurse aides who completed their training at long-term care facilities were at risk of losing their positions because they were unable to take the required examinations. The executive order temporarily suspended several state board of nursing rules governing nursing educational programs. The first order of business was to suspend the rule that dictated the number of clinical hours that were required for successful completion of the professional nursing program, the practical nursing program, and the nurse assistant programs. This allowed nursing and nurse aid students in their last semester or the last portion of their training to be eligible for graduation. The next rule pertained to clinical simulation as it relates to completion of a clinical rotation. The rule required that only a certain percent of clinical rotations could be completed by simulation. By suspending this rule, that allowed nursing students to complete their clinical rotations this semester through simulation. A similar rule requires that contemporaneous theory and clinical education take place. By suspending this rule, it allows programs to focus on theory education now and stagger clinical education as rotations become available. The executive order also suspended a rule that required faculty to supervise clinical settings, which allows students to count volunteer hours towards their clinical requirement. And finally, the executive order suspends the rule that requires nurse assistants to complete their required examinations, allowing them to apply for emergency licensure until such time as they can sit for their examination. Understanding the limited time frame of this order, the division continues to assess this dynamic situation. One option includes emergency rulemaking by the division director, which will extend the suspension of these rules for 120 days. This would allow the state nursing board to engage stakeholders and determine longer-term solutions. The unpredictability of the COVID-19 pandemic calls for the expansion of the available healthcare workforce. One way to accomplish this is through temporary licensure. Temporary licensure would be used to license persons with education and training in a profession who are not eligible for full licensure due to an inability to sit for the required examination or to complete postgraduate training. One example of this includes temporary licensure for international or foreign medical graduates. These medical graduates are ineligible for licensure because they've not completed the required postgraduate training in the United States. Many of these graduates have completed postgraduate training in another country, and in fact, many have practiced for many years as physicians. Temporary licenses would be available to enter the workforce. Temporary licensees would be available to enter the workforce through practice under the direct supervision of a Colorado licensee, thereby ensuring public protection. Temporary licensure for new graduates. The COVID-19 pandemic has resulted in the indefinite postponement of examinations. Although many examinations have reopened, with the social distancing requirements, the number of seats for each examination date has dramatically decreased. These examinations are required for licensure in a number of healthcare professions. To accommodate the thousands of new healthcare graduates otherwise ready to enter the workforce, emergency rules will be adopted to make temporary licenses available for physicians, physician assistants, anesthesiologist assistants, advanced practice nurses, professional nurses, practical nurses, nurse aides, dentists, dental hygienists, chiropractors, optometrists, podiatrists, physical therapists, physical therapy assistants, occupational therapists, occupational therapy assistants, respiratory therapists, speech-language pathologists, surgical assistants and surgical technologists, and veterinarians. Let's talk about the process for new graduates to obtain a temporary license. First, the new graduate should apply as soon as possible for their license. They should go to their board's website and apply for the temporary licensure. There is no fee for this application. If the applicant meets all criteria for licensure, for example, they've completed their education and training, they meet the minimum age requirement, then if they meet everything except for the required examination, a temporary license may be issued. The temporary license will be in effect from the date of issuance until December 31st, 2020. Once the new graduate successfully passes the required examination, the graduate should apply for original licensure. The normal fee for this application will apply. The next piece here is important. New graduates need to schedule their examination as soon as possible. Temporary licenses are non-renewable and do not create a property interest for the licensee. If a new graduate either does not sit for an examination or does not pass the examination within the term of the temporary license will expire. At that point, the new graduate will no longer be authorized to practice in their profession. They must cease practice immediately. Again, the temporary licenses will be valid from the date of issuance until December 31st, 2020. That means if the new graduate either does not pass the examination or does not sit for the examination, they will be unable to practice beginning January 1st, 2021. This is all possible because the executive order temporarily transferred emergency rulemaking authority to the Director of the Division of Professions and Occupations to ensure that professionals are immediately available to enter the workforce. The temporary transfer of rulemaking authority was for the Medical Board, Nursing Board, Dental Board, Chiropractic Board, Podiatry Board, Optometry Board, Physical Therapy Board, and Veterinary Medicine Board. The Director already holds rulemaking authority for respiratory therapy, occupational therapy, speech-language pathology, and surgical assisting and surgical technology. Allowing the director to make all of these rules at the same time will allow for an efficient rulemaking process and allow the temporary licensees to enter the workforce as soon as possible. In determining the emergency rules, the director will balance the need to expand the workforce with ensuring public protection. Considerations when determining these rules will include a national pass-fail rate for candidates sitting for the examinations for the first time, and ensuring new graduates have the resources they need to be successful as they await examination. We anticipate the emergency rules will be adopted on May 1st or May 4th. The rules are effective immediately upon adoption and stay in effect for 120 days. The individual boards will then have the opportunity to continue or amend the rules through the permanent rulemaking process. During this process, the boards will engage stakeholders and determine longer-term solutions for the workforce issue. The boards also have the option to allow the emergency rules to expire without engaging in the permanent rulemaking process. If you have questions about Executive Order 2020-38, please check online for guidance documents, including temporary regulatory changes, Smoothener, CNA pathways to graduation, and expand available healthcare workforce pool. Or check our online questions and answers for Executive Order D 2020-38. If these online resources don't answer your specific question, please feel welcome to contact us at dora_dpo@state.co.us, and someone will get back with you. Thank you for your attention.